Hi, good afternoon, everyone. I am Susan Newton. I'm with Lutheran Services in America. I'm joined by several of my colleagues and our partners and our great members. Kind of hate to stop that music, Chris. Thanks very much for getting us all in a great mood this afternoon. But being mindful of the time, we probably do want to go ahead and get started. We're expecting a few more people, but they'll either have a chance to view the recording and see the slides, or they'll be joining us in a few minutes and we'll catch people up as we need to. But I want to thank everyone for joining us for this information about an opportunity for new vaccine funding. Just as a reminder for Lutheran Services in America, if you haven't participated in one of our webinars before, we really do want to make sure that this is a safe space for learning and conversation, where we can all kind of share with each other and explore how we can encourage vaccine uptake among some of our most vulnerable citizens, older adults and people with disabilities. So all questions are valid and welcome, and please, use the chat or help us get the conversation moving by joining into the conversation. I think we're a small enough group and a trusted and safe environment that we really do welcome everyone's participation. So for today, we're going to hear from two organizations who are providing the grants and that Lutheran Services in America is in partnership with, and that's National Council on Aging and US Aging. And we're first going to kind of start with introductions and a check-in. But a quick question, just taking a quick look around the room. Are you guys here for general information, or are you really at a point where you're working on your applications and you have more specific questions? We want this webinar to be helpful, and if you just give us a little indication, then we can tailor the information a little bit better. You can either put something in the chat or take yourself off mute and just let us know. Okay, so it looks like it's a little bit of general information, general information. So great, you've come to the right place. We are prepared to share with you what you need to know to really get started in thinking about this opportunity. So a quick round of introductions I think would be really nice, and a check-in question. If you could let us know your name, your organization, and your role in the organization, and then what's the biggest challenge you see in getting vaccines to more people? And so Christy, I see you at the top of my screen, so if you don't mind, we'll start with you.
Hi, can you hear me okay? Hi, I'm Christy Hellenbeck-Ask. I was just adding my pronouns, but I made my whole name too long, so I used she, her. And as I put in the chat, we use WebEx in our organization, so I'm very rusty with Zoom. So I apologize. I serve as senior pastor and the director of mission integration for the Good Samaritan Society. And we're part of Sanford Health. We are based in Sioux Falls, South Dakota. And did you want me to share kind of general hopes for this time as well?
Or general hopes, or what are you all experiencing are some of the challenges in getting the vaccine to folks?
Sure. Well, I will say absolute full disclosure, I do not, we're a very large organization and I don't have a direct hand in vaccination processes. So I am really kind of collecting information to share with colleagues that do work in that space. So I really, from my seat, am more eager to be kind of a vaccine advocate from our mission perspective. So and a lot of our, since we are so huge, a lot of our folks who work more directly in vaccine rollouts don't have a sense for what our Lutheran Services in America partnership might allow us to do. So
Great.
I'm just here collecting information. I'm glad to be with you all.
Thank you so much, Christy. That's very helpful. Marta, would you like to go next?
Hi, I'm Marta Rieger from Lutheran Services in New York on Long Island. And I'm a director primarily working right now on a third-year grant from the Cabrini Health Foundation to provide senior services. We have a long history of providing services to deaf adults, mainly, with intellectual and developmental disabilities, and we've expanded that to senior services. So we're working on, getting partnerships. We don't have a clinical aspect to our services at all. So what we do, but we do have is the communication, the ability to do, the communication and training. And we've got very close relationship in the community of the deaf people. So I'm looking to today gather some information, and we've partnered, we've initiated some partnerships with, for instance, like a local university with their community, their mobile van, with their community outreach van. So I have a meeting with them later on in the month to reconnect for 2023. And now that we've got the money, we got in third year funding. So it's so to reconnect to those people and to see how we can perhaps partner to get the rest of the vaccines out. We were able to get to work with to get in the thick of things, to get the people that we actively work with, to get them all vaccinated through the second booster. But like everybody else, after that, it's gone down, it's not mandated. It's really hard to pull it together without a clinical piece. So I'm looking to just gather information to bring to the partners and see if we can collaborate to get that done.
Thank you, Marta. That's terrific. And I think our partners, Deborah and Susan, will be able to share that information. It'll be really useful to you. So, Heidi.
Well, thank you for the invitation. I am Heidi Freisinger, and I serve as the VP of Philanthropy for Ecumen. We are a senior care-based organization, primarily in the Midwest, and we provide services from independent living, assisted living, to memory care, hospice, and home care. So we have a relatively large portfolio, and we have a significant clinical presence. And I'm here to gather some information, understand more, because we're in rural areas, urban areas, suburban areas. There's lots of challenges that are really posed because of that. And the opportunity, I think, for collaboration to ensure that the vulnerable populations that might be in their home have access. And I think sometimes we're faced with the barrier of transportation. So how do we create ease to ensure that the most vulnerable do have access to these important vaccines and better the health for all of society? So thank you for the invitation. I look forward to learning more today.
Thank you, Heidi. Welcome, and it's great to meet you and to see you on the Zoom screen. And Joseph, I don't want to put you on the spot if you're not in a position to talk, but if you would like to introduce yourself.
Yeah, hi everyone. I apologize that my camera is off. I'm having some internet issues today, and the bandwidth seems to disconnect me, so I apologize. But my name is Joseph Fry. I use he, him pronouns, and I'm with Lutheran Community Services Northwest. I'm the Associate District Director here in the greater Puget Sound area, which is Seattle, the greater Seattle area. So we do cover a large area too, just like Heidi. We have a lot of urban areas, and we have a lot of really rural areas once you get outside of kind of Seattle and Tacoma. So we're really faced with challenges around transportation. We've offered, vaccine clinics before around this throughout COVID. And with our underserved communities, that's what we're really facing, is how do we get them to the sites where we're offering them, or how do we get them to more convenient community areas where these folks gather. So that's what I would say our challenge is right now.
Great, thank you, Joseph. I think we've all had the unstable network message from Zoom, so we totally understand where you are. So, but thank you for joining us. That's a really helpful context for us to kind of start sharing some information. So I'm going to turn it to Susan Stiles, who is with National Council on Aging. And Susan, if you could just give a brief introduction of yourself and your organization, I think that'd be a great way to start.
Sure, great. Thank you all for joining today. My name is Susan Stiles. I'm Senior Director of Healthy Aging Innovations at the National Council on Aging, and I oversee all of our Center for Healthy Aging work, which includes a number of different resource centers that support falls prevention, chronic disease self-management, and senior centers, and a number of different kind of innovative projects that we do, the Aging Mastery Program, the some bone health workshops, pain management workshops, a lot of different projects that we do in conjunction with different organizations and companies. And this project now too. So this, and that's a good way to just kind of kick this off. So a couple of months ago, both US Aging and NCOA had the opportunity to apply for some funding via the federal government. And if we could show the first slide, maybe, and go ahead to the next slide, thanks. To really get the word out to older adults that the getting a booster, getting a COVID booster, getting a flu shot, it's all still important. Even though in the, maybe in the news, in the public domain, we are hearing things like things are over. We all know that it's not over. It's not over, and that the, older adults and people with disabilities are really suffer the most from having either COVID-19 or the flu. So the federal government really wanted a way that we could do more direct outreach to community organizations across the country. And as you'll hear as we kind of talk here, NCOA will be focused on certain types of community organizations for this effort, and US Aging for other community organizations. But all together, the goal is really to increase vaccine uptake via those enhanced partnerships, that you were talking about in New York. Exactly, that's the kind of thing that we're looking at for the organizations to engage with, but really to ensure that older adults, people with disabilities, and their caregivers are getting the vaccines that they need to stay well. So next slide, please. So NCOA has an application process where we are going to be granting probably up to about 250 different grants to community organizations to engage in this outreach effort. We've broken this into two different tiers so that we could allow for organizations that are smaller and to be able to take part and build capacity, and then for organizations that are larger as well to take part in this effort. So the Tier 1 awards are focused on, probably a smaller organization, might be a senior center or CBO, that can target a specific population. The grant awards here will be a minimum of $50,000 and then a limit of $150,000. And then there's a set of Tier 2 awards, and this is really for those organizations that have that broader reach. Maybe it's across a city, it's across a region, might even be across the country. So we know that a lot of organizations have been involved in vaccine outreach efforts. So it's a way to engage with them and to offer them the opportunity, again, to take part in this initiative. The minimum award amount here is $450,000, and there really is no cap on the award. And that's kind of a change. If you had looked at our NOFO before, that's a little bit of a change from the beginning. There is not a cap now on that Tier 2 award.
I am Susan. So real quick,
Sure.
a question. I know we all deal with a lot of acronyms, but I'm not sure I know what did you say NOFO?
No, oh, I'm sorry. Notice of funding opportunity. I'm so sorry.
No, you're good. Thank you.
So the notice of funding opportunity, and we'll have that information a little further down so that you can go to the NCOA website and find out all of that information. There's a link to the application portal and our FAQs. So next slide, please. So the eligibility for the NCOA grants, so this is just the NCOA specific grants, are again, those community-based organizations like a senior center, community center, maybe a community organization that that supports older adults with disabilities, a faith-based organization, governmental agencies, and then other, and it's kind of a big bucket, but other federally recognized nonprofit organizations. So that even could be a university, or you could partner with a university as well. So those are the eligible organizations under our grant funding. And next slide, please. And the types of activities that are eligible within this grant funding, I mean, first and foremost is really getting people to get vaccinated. I mean, that's really the primary goal of this whole effort. So it's about hosting COVID-19 and flu vaccination clinics, providing in-home vaccinations, and or getting people to a place where they can be vaccinated. So those are kind of the main activities. We know that there's a lot that goes into supporting those activities. So doing the outreach, the education, identifying people who might experience barriers, to getting either of these vaccinations, identifying people who need that additional level of support. All of that kind of feeds into the actually getting people vaccinated. So those are eligible activities also within the application. And I see a question from Christy here.
ELCA is the Evangelical Lutheran Church in America. So
yeah.
Sorry about that. I should have defined
that. As long as it's a nonprofit, and I'm assuming that it is, it would qualify. Mm-hmm.
Thank you.
Next slide, please. Then I wanted to kind of just give a little snapshot here of the application itself and the way it's scoring. We tried to make it kind of as straightforward as possible and have and not put too much of a burden on community organizations in filling out the application. So it has, some sections that you're probably familiar with other applications. But one thing I did want to include, or just let you know about, is that we really would we would love to see inclusion of a senior center, an FQHC, or a public health department, if possible. It's not a requirement. But if there is that inclusion, then it kind of gives you a few extra points in the overall application. And, in terms of like our philosophy about, looking at the applications, we're really looking at things very holistically. We're well aware that every organization brings different strengths to the table and that different populations have different needs. So we're paying really close attention to that as we, we want to create as equitable distribution of these funds as possible. And so we're looking at a number of different factors as we look at the applications. And, while the points matter, sometimes it's about, if we've had a few examples where we've looked at an application and we've wanted to have a little additional discussion with the applicant to get some more insight or context for certain items. So we're really open to being as inclusive and broad-based as possible as we're looking at the applications, really, looking at, how well do you know your population and what those needs are, and being able to kind of tie those needs with some, your ability to provide those direct services and align it with an implementation plan to educate and, get people their vaccinations. Next slide, please. So I wanted to just highlight some of the questions that we have been getting. Mostly, we have a whole frequently asked questions on our website, but these are the ones that kind of keep coming in and are bubbling up. And feel free to include any other questions in the chat as we go here. One question that we've gotten is there a minimum number of vaccinations required if you're funded under Tier 1 or Tier 2? And the answer to that is really no. We have some different categories or numbers of vaccinations, like 0 to 500, 500 to 1,000 and above in the application itself. And we recognize, again, that different areas are going to require different types of interventions. So, for example, in a rural area, it might be more difficult to get to a large number of vaccinations, whereas in other areas, it might be a little bit easier, or there might be language barriers or other things that limit the number of the outreach and number of vaccinations, or just make it, one step a little bit more challenging. So we don't want to prescribe any minimum number. Excuse me, but just, kind of balancing out if that number of vaccinations kind of aligns well with the budget that is proposed. Can grant funding be used to cover the cost of vaccines? This is a question that's come up quite a bit. And right now the answer is no, it cannot, cover the cost of vaccines. But we are in discussions with ACL about how that, if that might evolve, if that requirement might evolve from their end. Right now the COVID-19 vaccines are still covered. There is there will be a little bit of a transition to the private market probably next fall for the COVID-19 vaccines. But there was, just some word out from Moderna yesterday that I think they will plan to give vaccines, for free, for the foreseeable future. And I think, Deborah may speak to this a little bit more because they've been a little more active in some partnerships that they've done, or that they're already kind of looking at with different pharmacy organizations across the country to help, ensure that people who need these vaccinations are covered. Can grant funding be used to pay for contracted staff or outside entities? And the answer to that is yes. And we certainly encourage you again to to have partnerships with outside entities, and it may be a nurse at a public health department. But just include that in your budget. But yes, the grant funding can be used to pay for contracted staff. How about for marketing activities? Again, the answer is yes. Grant funding can be used to pay for marketing activities. And just a side note on that is that we are preparing some different marketing toolkits that will go out to the field shortly. So we are going to be supporting a lot of marketing activities and working also with a PR firm to help support organizations locally and on the ground with different media activities. And our, through our technical assistance and our support throughout the length of this grant, we'll be very much involved, also getting feedback from organizations on what types of marketing materials you might need or want us to help co-develop. So, but if you have something really, discreet and special that you want to, that you think this funding, this grant funding could be used for in terms of marketing, please go ahead and include that in your budget. Another question we get a lot is about incentives. And this grant, can be used to pay for incentives up to $25 per person. So that's one. So that's one good thing, especially again as we're sort of at a point in the pandemic where people are questioning in different ways, why they need to get a booster shot or even get their flu shot. We also have, we know that this grant is mainly for, older adults, 60 plus and individuals with a disability, but we know that we work with a lot of organizations that are more intergenerational or have an intergenerational component. So we have gotten some questions about whether and more of an intergenerational vaccine clinic or outreach is appropriate and can be counted. And yes, that is a possibility here. We would just want to, kind of emphasize that if you did run an intergenerational clinic or do some outreach, that the focus would be on older adults and individuals with disabilities. So, we want to keep the focus there. We certainly don't want to turn away, 30, 40 or 50-year-olds who come in to get a vaccination. Data collection. What will data collection look like? So US Aging and NCOA are both going to be using a similar data portal to upload information about both vaccination clinics and vaccination outreach. And it will, if your entity comes on board, you would be get training in the portal and how to upload information from the work that you're doing, and also the portal has a pretty neat way of capturing information from individuals. And all that information that we're capturing is, of course, anonymous. There's a light amount of demographic information, but all of that will be kind of captured in one portal, and any grantee would have access to their own, dashboard, so they can kind of also track how they're doing. And then the final question, this is really important around financial documentation for both the Tier 1 and 2 grants. We have recently updated some of the requirements for Tier 1 and 2 grants. Again, as a result of some feedback that we have gotten from organizations and wanting to be as equitable as possible across the board, we have updated our financial documentation. So I would encourage you to, go to our website. We'll provide the link in the next slide, and have a look at that. But essentially, for Tier 1 grants, you will need to submit a 990 form from the IRS or a 990 EZ. So we've kind of opened that up. And previously we had required Tier 1 grantees to provide an audit. We've eliminated that necessity for an audit. But if you don't have an audit, you will need to provide some supporting documentation or as to why you don't have it. But we've eliminated that requirement that you need an audit. So I think that's going to be really helpful. And then for Tier 2 grants, the question of the audit again has come up for those grants. And we do require an audit for those, but we are also encouraging organizations that maybe are not able to have an audit or haven't had one in the past to work with a sponsoring organization in order to be able to comply with some of the requirements that we have on our end just for monitoring this grant. So I know I ran through things really quickly, but I want to make sure we have enough time. I think, was that my last slide, Chris? Yeah, so we do have a deadline of March 1st, for the applications. Awards, though, will be made until all funds are exhausted. So we're accepting award or applications on a rolling basis. The two important links here, the one is to that notice of funding opportunity that has a lot of information on that page, including a really long list of FAQs. And then if you have any other questions after this webinar, we do have a help desk that's open, and we will respond to your questions within 48 hours. And I think that's it. Yeah.
Thank you, Susan. I was just going to NCOA website and picking up, I think I got the right web link to the main page for
Thank
the
you.
vaccine.
Yeah, that's helpful. Yeah, perfect.
So okay, well, anyone have any questions specific to Susan, or how what we might do is hear from Susan and then from Deborah Stonewallings with US Aging, and then we can kind of see if there are questions at the end. But if anyone has something specific for Susan, would you like to ask it now? Okay, Deborah, we'll start with you, and I'd like to ask you and Sarah Maloney, your colleague at US Aging, and I hear a former Lutheran Services in America network partner in a couple of different ways. So welcome, Sarah. It's great to see you, but maybe you could do quick introductions of yourself and then share your information.
Sure. Thanks very much, Susan. And I'm so proud of myself that I remembered to unmute. Yes, Sarah Maloney actually is joining our US Aging vaccination team. So we're really excited to have her. She'll be the program director for this initiative. Susan Stiles, when you just mentioned, when you said we'll be doing applications until all the funds are exhausted, I thought it's a good thing we're not stopping when the people are exhausted, because both NCOA, US Aging, and I have to say ACL have been working literally around the clock to get this opportunity up and running. So we're very excited about that. I will say that our two initiatives, we both responded to the same NOFO, Notice of Funding Opportunity. There was option A and option B. So US Aging applied for option A, NCOA applied for option B, and we are separated with a permeable dotted line, I will say. You'll find a little bit of seeming overlap, but I think we've worked really well to try to be clear with folks. which grant should I apply to? That's a question we get sometimes. Should I apply for NCOA or US Aging? Hopefully we can clarify. There are some gray areas. Nonprofit agencies that serve older adults or people with disabilities. Kind of one of those gray areas that we've been doing really well working together. The main thing is we are working to keep people from applying both to US Aging and to NCOA. That could cause confusion for all of us. So we're asking agencies to either apply for option A or to apply for option B. So I'll just tell you a tiny bit about myself. This was one program I know NCOA has also been involved in vaccination initiatives. US Aging has as well. For almost 2 years, I've been overseeing the Community Rise Together vaccination grant. At US Aging, I also oversee a variety of social engagement programs, transportation initiatives, housing, dementia-friendly volunteer initiatives. So dementia-friendly initiatives, volunteer initiatives. And then we have 2 national call centers, one for older adults called the Elder Care Locator, and then one for Dial that actually emerged. It's the Disability Information and Assistance Line. That Dial emerged as a result of COVID, when it was recognized nationally that there wasn't really one place folks with disabilities could call and get information. So both of those call centers have been instrumental in helping us further all of the work we're doing at US Aging. So we can go ahead and start the slides, Chris, and skip to the next one. We are calling our initiative the Aging and Disability Vaccination Collaborative. And the next slide. The reason for that is we kind of have 2 pieces of it. One piece is we are now partnered with 25 national organizations that specialize in aging, disability, and diverse populations who are poised to provide technical assistance and support for this grant initiative. One of those agencies, as Susan mentioned earlier, is the National Pharmaceutical Association, and they are really committed to working with, and that's not their correct name, I apologize. But it's a national organization that works with several small pharmacies across America. And they are committed to working with grantees from either NCOA or US Aging to help them get connected to some of those more clinical needs. Many of our prospective grantees say, we don't operate shot clinics. And we say, you don't need to. We can put some things in place that can help you include the vaccines as a part of your ongoing partnerships with a variety of entities that actually do focus on the more clinical aspects. The other piece of our initiative are those local grantees. We are anticipating about 400 organizations to apply right now. We don't have that many grantees, but what we're finding is grantees are coming, or these local organizations are coming together in partnerships. I believe at this point we have about 150 local organizations that are engaged in partnerships on the ground. And those partnerships are working to, of course, increase the uptake in their local areas. Next slide, please. Our focus, as Susan mentioned, is to reach older adults and people with disabilities. And although this grant does maintain that focus on COVID and influenza, we have been instructed that if someone comes, like, let's say you have a pharmacy partnership and they also have the shingles vaccination or the pneumococcal. I learned how to spell that in the last few months, which is kind of cool. The pneumonia shot. Those vaccines, while not the focus of this grant, they can be counted towards your overall, hey, we helped 3,000, we helped get 3,000 vaccines in arms. They can count in that regard. Our grant amounts are generally ranging from 50,000 to 1.5 million. We also do not have a cap, but we need to have a clear understanding of, what activities are being built into your day-to-day operations that then necessitate your budget or your budget request. So while there's no cap, we do look for what makes common sense. And then ACL is really clear with us that all grant activities need to be met either through the internal partnerships or through external partnerships. And we'll hit on those in a few moments, but next slide gives you a picture of who goes to option A, which is the US Aging Initiative. So area agencies on aging, no wrong door systems, Centers for Independent Living, Title VI Native American programs, single state planning and service area territories. There are 7 states in America that don't have area agencies on aging. Rather, they work through a single state. The Dakotas, frankly, are one of those. And I can't see all the names of the participants, so I'm sorry I forgot your name from South Dakota, I think you said, or no.
That was me, Christy. Yep.
Okay, Christy. Yeah. Yeah. So the Dakota is one that will be, working through their state unit. Other ACL funded disability networks, and then there's that catch-all of other aging and disability community-based organizations. What we've been telling folks, and again, US Aging and NCOA have been working closely. Sometimes we're getting, both of us are getting questions, who do I go to? And we're really working hand in hand to make sure that if you have a question about which application to pursue, that we're trying to be very supportive to make sure you're working with the group that is going to best meet your needs. And what I'm telling folks is if you partner with an area agency on aging to meet this work, or a no wrong door system to meet this work, or a center for independent living, it's fine to apply through the option A grant. So, but this kind of gives you hopefully a little bit clearer picture of who would best fit, I guess, with option A. Next slide, please. And again, the grant activities fall in 3 buckets: vaccinations, community-based, or in-home. We are having partners that are working with local home health care agencies, because those agencies can go into the homes. They can bill for vaccinations given through those individuals' insurance or Medicare or Medicaid. So vaccinations is the first bucket. Second bucket is supportive services. Are you helping folks just even know where to acquire the vaccination or make an appointment to acquire the vaccination? Are you helping them with transportation? Some folks require personal assistance to get to a vaccination, someone to stay with them during that vaccination, and then someone to help them until they reach home. You may have a partner or a volunteer agency that could help you with that. And then are you providing referrals to other services that individual may benefit from or may want? You don't have to hit every single one of these supportive services, but we're asking that you provide at least one of them. So that's the second bucket is supportive services. And then the third bucket, which we're finding is maybe the most, it's the lowest hanging fruit of all of this for some of our agencies, would be that outreach and education. Do you have a network? Can you outreach to folks? Can you let them know when events are coming to their area? Do you have a social media presence? So those three buckets are the main pieces. And again, then the last piece would be, how are you going to report and financially document all of the first three buckets of direct service? Susan did mention that US Aging and NCOA have collaborated very closely to create a service documentation platform that we're hearing from our grantees is spectacular. So people are finding it easy to use. When COVID hit, I was actually a AAA director, an area agency director in Maui, Hawaii. And I was on the front lines for the first 2 years of COVID. So I really get how documenting these daily services and the maybe monthly outreach events, I knew there needed to be a simple way to make that all happen. And we've all worked together to create an effective and easy to use service delivery documentation platform. We will also be asking some narrative questions. Our grantees will meet with their grants manager once a month. We want to hear how we can support you. We want to hear the creative things you're doing, what's working, and then we want to help you share that with each other in peer settings. And then, of course, there will be financial reports as a piece of it. Next slide, sorry. How to apply for option A. There will be, and maybe Sarah could put our website in the chat for you. On our website, we have a link to apply. Our application has two sections. The first one is just an eligibility screening. So you'll answer some pretty easy questions about who you are in terms of what kind of agency are you. We'll make sure you fit in one of those option A eligibility buckets. And then the second piece is of that eligibility, are you willing, do you commit to either performing these grant activities that I already mentioned as your agency alone, standalone, maybe you have that capacity, or in partnership. So upon those two responses, if you're deemed eligible, we put you through to our application. If you're deemed not eligible, we give you an email to reach out to us, but we also will recommend that perhaps you contact NCOA to see about the option B package. Our application is non-competitive, so online you'll fill out general agency information. You'll let us know what your intents are. How many vaccinations do you think you can facilitate? How many people can you support with supportive services? And then how many people will you touch through those outreach and education? Then we have you complete a proposed, then we ask about your demographic reach. Are you going to be reaching out to specific people populations? If so, which ones? Are you rural, suburban? That just helps us kind of know how to better support you. And then we ask about who might your potential partners be. Like NCOA, US Aging has been very impressed with the breadth of partners that people are bringing to the table. And if you're curious, if you're kind of stuck on that, I'm sure that both NCOA and US Aging could help you brainstorm who might your partners be? We can help with that if you want some input in that piece. And then we ask you for your budget. We have a proposed budget calculator that kind of looks at all of these pieces. How many people you want to reach? Who are you reaching with the specialized targeted population groups? Are you urban or rural? And then what partnerships are you bringing to the table? That gives us kind of if you will, a framework for how to set a budget for this particular work. Then after you get a proposed budget, we ask you, does this meet your needs? And if you say yes, if it's the right amount for you, then you'll fill out the budget form. If you say no, then we'll ask you, is the budget too high or is the budget too low? And we have had people answer that both ways. Some say, oh, that's too high. We only need this amount, and this is why. As well, we've had people say, ooh, that's a little low because we're in a territory and we're going to be doing in-home vaccinations for people that sometimes require us to travel up to 50 to 100 miles. So if it's too low, we just want to know why it's too low, and we'll work with you on that. Generally, there are some follow-up questions. Again, our grant process is non-competitive, so we'll engage you throughout the process. We can answer questions as you go and hopefully help you formulate, your budget, your plan, and your work plan. The work plan will be due after we've agreed that this looks like the best option for you. And then we'll get into the more nitty gritty about what you're planning to do and when. We are reviewing and accepting applications on a rolling basis, and we do not have a deadline. Of course, either when our funds are exhausted, then that's when we will end the application capability. And finally, the last slide I have is how you can get in touch with us. We do have a dedicated email helpline, if you will. And we also have links on our website. We have facts on our website. Our frequently asked questions are very much similar to NCOAs. So I did not pull those out separately. And then you can see our website address at the bottom. If anyone needs those put into the chat, I can do that. But that sums up our initiative, and we certainly welcome any questions or any conversation.
And thank you, Deborah and Susan. I mean, that was incredibly comprehensive. And I think a lot of the questions that we had been gathering, which grant to apply for, application dates, what kinds of activities, can this go to help support staffing, what reporting is required. I think you really did a great job of covering a lot of those questions. But I know we only have a few minutes, but if anyone has a question from the Zoom room, we've got Susan and Debbie on the line for a few more minutes. Marta.
So just have sense, because I haven't done a grant like this with a partnership, gone in with a partner first. So should I have this partnership agreement outlined, set up first and then do the application? Should I be the silent partner or the forward facing partner? How, is any direction that maybe you could send me in?
Okay, I can jump in, and then Susan, for us, I think it's going to be best if you have an idea of what that partnership would look like.
Mm-hmm.
We don't need to have a written agreement, but NCOA may, because their process is a little different. but I think it's, according to your partner, it's gonna be, you want the primary partner to be able to handle the fiduciary responsibilities. So I think it's going to depend on who your partners are and how it's going to work best for you.
Yeah, I would agree with that. I would certainly have that conversation with the potential partner and discuss it together. If there is funding that you think that you would want to provide to them through this, then include that in your budget. And, you know, a letter of commitment never hurts, not required, but it certainly wouldn't hurt. So if you are, you know, thinking of a local healthcare entity, I don't know, whatever it might be, and for them to have that, but no other specific requirements on partnering.
Thank you.
Mm-hmm.
I have a quick question. First of all, thank you both, Deborah and Susan. This has been really, really helpful. I feel like I understand so much more about this process now. And my question kind of goes back to Susan. You had, we're kind of going through the FAQ questions, and I apologize. I was dealing with a staffing issue and I missed the details about purchasing vaccines. Is that included in the budget and that piece? And I wanted to make sure from a planning perspective, as we look at everything, feasibility studies, do we, you know, does this, like, for example, the tier 1 NCOA 150,000, do we need to use that sum of money to purchase vaccination items?
At this time, the purchasing vaccines is not allowable under this
Okay.
fund. So we are encouraging people not to include that, you know, within their applications. As I mentioned, we are seeking more guidance from ACL on this, but right now the good news is that, you know, at least for until probably the fall, the COVID-19 vaccines will be available to all. And then the flu vaccines are often covered, you know, via insurance. But it is a question we've been getting. We are going to continue to, you know, have discussions with ACL and get more information about this.
Thank you so much.
Sure.
I had a quick question, not to cut off anyone else, but so I love how you described, Deborah, the permeable dotted line between the two organizations. And you aren't really encouraging people to apply to both, which we appreciate. Why do 2 applications? But is it fair to say that if one of you got an application that seemed like a really strong application, but just submitted to the wrong organization, do you have a partnership where you would be able to kind of say, hey, why don't you take a look at this one?
Yes, we do. And we have been, I've been working with Vivian from NCOA, who is involved in their option B piece of it, to look at those agencies who may better fit with the other option, right? So yeah, we're working very together on this. It is not a competitive endeavor at all. We really want each agency to be in the best fit. So we're working together.
Thank you. That's great clarification. Anyone, I know we're just even 2 minutes over. Anyone else have a last question?
This has been super helpful. I'll just ask the proverbial question. Is it possible to share the slides?
Absolutely. We'll probably tomorrow, or, you know, depending on how quickly we can turn it around, we'll send an email to everyone who registered with the recording. So if you missed anything, you'll be able to see it again. And the slides of the separate slide decks, not just in the recording, but we'll attach both slide decks as well. And I just want to thank Susan Stiles, Deborah Stonewalls, and Sarah Maloney. I've been working with them with Lutheran Services in America as a partner at this level so far today, and I'm just so impressed with the amount of time and effort that both organizations have put into it. But even beyond an efficient and well-run opportunity to apply for vaccine funding, just their willingness to really work with people, right? You know, the goal, as Susan said, is we want to get these vaccines to people who haven't had them yet. And I think their commitment and ACL's commitment and our commitment as Lutheran Social Ministries Network, it matches. And I really can't thank you enough in a world where sometimes we look too hard at differences. You know, you guys are really emphasizing how we should come together. And I will continue to help spread that message throughout Lutheran Services in America Network. And I know my colleagues will do the same. And this really is just an honor to be working with you all on this. And the strength of being able to bring outside thought leaders to our network, we really, really appreciate your time and spending it with us today. So
we appreciate your partnership as well, Susan.
Thank you. Yeah, we have one more opportunity coming up yet this month. If you all haven't had a chance to see that, we have the director of the Center for Innovation from CMS joining us, Dr. Dora Hughes. Another great opportunity. I know she'll be addressing some of these issues around health equity and connecting with different audiences that don't always get served, and how we as a social service network can help reach out and bridge some of those gaps in service. So we're looking forward to that. And Deborah and Susan, you're welcome to join us. It's on our website if that's interesting to you all as well. So thank you all so very much for your participation today, and I will talk to you all soon.
Thank you.